So I'm very pleased to introduce Simon Hammett, who is on the board of the Global Business School for Health. On the MBA Health, there are two consulting projects, one group project in Saudi Arabia, Nigeria, or India, and an individual project. So we're very enthusiastic about developing our students' consulting skills, and for those who are interested in a career in management consulting to have networks and experience in that sphere. So, Simon, I'd like to ask you about your own experiences in consulting and your involvement with UCL and GBSH.
Thank you, Julie. So for many years, I was a senior partner at Deloitte and led the life sciences and healthcare industry practice across Europe, Middle East and Africa. I joined Deloitte's strategy practice after completing a full-time MBA myself, actually. And for many years, my work included major product launches, research strategies, large-scale merger integration and organization design for some of the world's leading pharmaceutical and medical device companies. I was partly based in London, but partly based in Switzerland and worked in many countries actually around the world. When I retired in 2016, I completed the master's program in business psychology at UCL and now operate as a leadership coach and board advisor. And I was excited to hear about UCL's plans to launch the Global Business School for Health, and also very pleased to be appointed as a member of the External Advisory Board.
So, Simon, I wonder if you could give us a summary of what do you think are the key competencies for being an effective management consultant?
Well, in my experience, particularly in life sciences and healthcare, there are some incredibly smart people working within the clients themselves. So when you come in as a management consultant, it's helpful to understand the industry and to have the vocabulary and to connect to those people in the organization. And you may have some areas of deep expertise yourself, but it's really important to be able to stand back and have a balanced perspective and to draw on a wide range of learning and experience. That's the value that you bring. It's about creating a structured approach to problem solving, understanding how to connect to the client's own expertise to drive innovation and change. Therefore, an ability to listen and to articulate using the same language as the client, but also bringing new skills and capabilities to have a whole and complete solution for the client.
Thank you. That's very interesting. Yes, I think speaking different languages in terms of different occupations is very important. So I'm interested in your views on how healthcare professionals might consider hiring a consultant. What would they be looking for?
Yes, I mean, this is a question I've asked myself for over 20 years in management consulting, and particularly within the life sciences and healthcare industry. I guess the first point is they're always looking for people who take the time to understand what it is they're actually trying to achieve, their requirements, the purpose of the work that they're being appointed to take on. And often a term you hear is, I don't want to see your cookie cutter approach. So it's that first engagement at the beginning when you're in a sales mode from a consulting perspective is really important in terms of communicating how you're going to work with the client and the sort of tone and communicating your expertise and the way in which you'll go about actually working with the client. So that's important. The second thing is having relevant experience, and that might include industry, technical skills, so an ability to actually use the same language as the client and to easily understand points that the client's senior people are trying to make, but without necessarily having that sort of deep expertise. So an ability to talk to people in different areas of expertise and sort of pull their thoughts together. But it also involves them. You know, the question I was quite often asked was, where have you done this before? How have other organizations solved this same set of issues? So experience counts for a lot. And therefore being part of a team where you have a blend of those different attributes is important. The third thing is, each management consultant needs to be very capable, and that means being analytically rigorous, good at putting that sort of structure in place, problem solving, The clients tend to look to academic achievement, I guess, as at least one source of comfort that the consultants working with them have that capability. And I think the final thing is about being articulate, humble, and sensitive to the client's culture. Often as a management consultant, you're working with very senior people in the organization. You'll be working with sensitive information. You'll perhaps be working in a joint team with the client, and you might be working on site for many, many months. So they want to make sure your face fits and you sort of appreciate the nature of the organization that you're working with and are able to adapt and perform within their culture and within their organization.
That's very helpful. Thank you. So in terms of careers advice, what would you say to someone who would like to be considered for a role as a consultant to join a firm?
And a question I've been asked many, many times, because obviously I used to hire a lot of people into management consulting in my previous life. I mean, I think the first thing is to recognize there are lots of different forms of management consulting. I focused on strategy and operations consulting, but there's also technology and digital, and there's HR organizational consulting. Also, professional services reaches across into other areas, including finance and M&A, all sorts of areas. So the first thing is, what sort of things do you enjoy doing? What do you aspire to achieve in terms of your advisory and consulting work? What are the few things that you feel you would want to learn over a 3 to 5 year period working in a professional services firm? So that's the first thing, and that's actually quite a complex question that requires some thought. Second thing is, do some homework. Find people that are working in those roles and network with them. It's very easy, and I often get calls saying, can I have 20 minutes of your time just to understand what it's like working in your organization, and hearing a little bit about your own career post-MBA as you joined the organization and how you progress within it. I do quite a few of those calls every year, and there's no reason why you couldn't get in contact with friends and colleagues and people that you know in the sorts of consulting firms that you feel you'd like to apply to. The third thing, and probably the biggest mistake people make, is they don't think about applying early enough. And although there's not necessarily a formal melt round, decisions on recruitment are often made a year, 8 months, 6 months in advance. And so as soon as you start your MBA course in September, within 2 or 3 months, you should be really contacting companies and starting to get your CV in, start the networking, try and understand the recruitment processes that are in place, and make sure you're ahead of that rather than either catching up or even missing some of the deadlines. And the fourth thing is to have a story to tell. And make it interesting. What's your previous experience? Why have you done the MBA? Often people talk about the T, which is that they've had an opportunity to really deepen their skills in the sort of previous work life. And the MBA will give them an opportunity to pull together some of their experiences and create the shoulders of their expertise, so they're able to work more broadly across a wider array of different issues. And actually, management consulting firms really look for that sort of T-shape, some areas of expertise, of proven ability, coupled with broad shoulders and an ability to be adaptive and to work with clients on solving their problems in their language and against their requirements. So think about that narrative, the story that you want to tell, because you'll be asked about that very, very quickly in the recruitment process.
Thank you. Your comment about T-shaped individuals, that's very interesting. Thank you very much. So the final question, how do you believe the MBA Health will actually accelerate students' careers and develop their consulting skills, whether they go into consulting or not, to make a positive impact?
So Julie, the reason I'm really excited about the MBA Health is that it's a very rare thing to find people who've got deep expertise, clinical, medical, have experience of working in life sciences and healthcare, but also there's a wide array of additional new skills that the MBA brings, such as financial management, digital and technology skills, organization design, and so on. When I used to hire people into my life sciences and healthcare practice, I got very excited when I came across people who had this sort of T-shape, the depth and previous life experience, particularly in a sort of life sciences, healthcare and medical context, but also had those broad shoulders that enabled them to talk about a client's issues in a very broad way, sweeping way across different departments and different ways of viewing challenges that those clients had. So the MBA Health is somewhat unique, I think, at this point in creating both the shoulders and allowing people to then go on in their future careers and use some of the depth of experience that they'd had before.